Alright, I understand and consent that the following information will be gathered and utilized for educational purposes by Indiana Wesleyan University. I allow this information gathering and physical assessment to be videotaped and posted on Blackboard for access by faculty and students at Indiana Wesleyan University. The video will be deleted by the student as soon as it has been reviewed and graded. I further acknowledge that this is for educational purposes only, and that the information is not meant to be diagnostic. Therefore, Indiana Wesleyan University, the faculty and staff, as well as the student, are not considered liable.
This is Monica. She's my 25-year-old patient. She comes in with a 1-week history of elevated temperature. Her current medications include albuterol inhaler, 2 puffs every 6 hours is needed, minocycline 100 milligrams twice a day, and Advair 2 puffs daily. Her only health history is seasonal allergies and asthma. Good morning, Monica. What seems to bring you in here today?
Well, I've just really not been feeling well lately. I get bronchitis about once a year, but this feels different. I'm having a really hard time breathing. I keep coughing this really gross stuff up, and I've had a fever, I've had a headache, I just really don't feel good. I can't keep fluids down, I can't keep food down, and I just really decided finally it was time to come see a doctor.
Okay. Well, I took your vital signs before, and your respirations were 24, your pulse was 100, your temp is up to 104, and your pulse oximeter was 92%.
What's a pulse oximeter?
Pulse oximeter is the thing that we clipped on your finger, and what it reads is how much oxygen is circulating around in your bloodstream in order to oxygenate all the blood, or the body parts and organs. Okay? All right, so I'm going to go ahead and do my assessment on you. First thing I'm going to do is look at your eyes. Your eyes look red. They are watery, and I do notice that your eyelids are a little bit puffy. Your nose is red also, and the mucosa looks like it's also red and swollen. Have you been having a hard time breathing out of your nose?
Yes, it's impossible. I have to breathe with my mouth open, and it makes it really nasty in the morning.
What about your throat? Is your throat sore or anything?
Yes.
Okay. Let me get a tongue depressor. Open up there. Okay, your throat is red. I do notice a lot of drainage in the back, and your uvula is swollen. I'm sure it's been very difficult for you to breathe, let alone swallow. I'm going to check your lymph nodes here, and those are what are kind of like sponges, and what they do is they help filter out all the viruses and the bacteria. And those feel like they are a little bit swollen also. Your skin feels a little bit, it's pink, but it feels like it's a little bit moist. Have you been having a lot of sweatiness?
I've been waking up and sweating completely through my shirt.
Oh, goodness. Okay. All right. We're going to do another test called a capillary refill. What we do is we push down on your fingernail and see how quick the blood comes back, how it goes from white to pink. That's another indication of how well you're circulating oxygen in your bloodstream. So I'm going to push down and come back. That's really good. So it looks like you are oxygenated well. Next, I'm going to listen to your lungs. Have you been short of breath at all?
Very.
Okay. All right, I'm going to have you take in breath slow and deep and exhale. Are you ready?
Mm-hmm.
Okay. In and out. Okay, we're going to do the back now. Same thing. Couple more. And one more. I notice you have quite a bit of crackles, as we call it, or rough sounds down in the bottom of your lungs, and it also just does not sound like you're aerating very well. I notice you have quite a bit of wheezing, too, when you breathe outward. So, you know, make sure and take your albuterol inhaler as you need it. I would recommend, at least for the first couple days, that you take it 4 times a day. I am going to check your rib area here real quick and just breathe normal. I do notice that when you're taking breaths in that you have what we call intercostal retraction, which means that you're really working hard to get a deep breath in. I'm sure you can tell that. Your heart rate's also up a little bit, and that'll also be from the fever that you have. Okay, so when you go home, what I want you to do is I want to make sure that when you're laying in bed that you elevate the head of your bed. I want you to do the respiratory treatments that your doctor ordered for you. Make sure and take those 4 times a day. I want you to drink plenty of fluids, because when you drink a lot of fluids, it helps make the secretions a lot thinner, and you'll be able to cough that out more. Don't be surprised if you're on the antibiotics that you don't cough out more, because it's helped loosening everything up in your lungs. I really recommend that the first 24 hours that somebody in your family stay with you. That way they can make sure you get plenty to drink, you get plenty of rest, and that you won't get up and do too much. Make sure and take your steroids on time. And if you're not better in 3 days, you're going to need to come back. We may need to admit you to give you IV fluids, IV antibiotics, and steroids, and possibly oxygen for your...
I think I'll take my medications. Thank you.
That sounds like a good deal.
Yeah.
So, do you have any other questions I might be able to help you with?
No, not really.
Okay. That sounds good. Then we will see you back in 2 to 3 days if you're not any better. Would you like me to say a prayer with you to help you with the healing process?
I appreciate the offer, but thank you, no thank you.